and welcome to Scotland County Health Department's New Hire Orientation. Our mission is to promote quality health through education, disease prevention and control, preparedness, and environmental protection. Our vision is for healthy communities and healthy environments. Our core values are integrity, excellence, collaboration, innovation, and respect. Our values always reflect principles that our department displays as we interact with coworkers, agency partners, the community, businesses, and the public. Public health law. Public health law is a field that focuses legal practice, scholarship, and advocacy on issues involving the government's legal authorities and duties to ensure the conditions for people to be healthy and how to balance these authorities and duties with individuals' rights to autonomy, privacy, liberty, property, and other legally protected interests. The scope of public health law is broad. Public health law issues range from narrow questions of legal interpretation to complex matters involving public health policy, social justice, and ethics. A local board of health is the policymaking, rulemaking, and adjudicatory body for public health. It is composed of 11 members. County Board of Health members are appointed to 3-year terms and may serve a maximum of 3 consecutive 3-year terms. Administrative policies. Cell phone policy. The use of personal cell phones or other electronic communication devices are limited during working hours. Employees may use their cell phones or other electronic communication devices during lunch or break periods or in a private space that is away from patient rooms and employee work areas. Employees cannot use their cell phones while operating county-owned vehicles. Confidentiality policy. It is essential for all employees to understand the importance of ensuring a patient's or client's confidentiality. Employees may not discuss patient or client information with family or friends. Employees must not share a patient or client's information unless that employee is on a need-to-know basis and are covered under the HIPAA policy. When discussing the patient's or client's information, employees must always secure the patient or client in a location away from others when discussing their information. Employees may use a noise machine in applicable areas to serve as an additional sound barrier to ensure confidentiality. Customer service expectations policy. It is our policy to ensure a tradition of pride, respect, and excellent customer service to all clients, employees, and visitors of the health department. We must exhibit courtesy and respect for everyone, be responsive to all that visit the health department, exhibit professionalism, ownership, and commitment to our job and organization, provide follow-up when necessary, and maintain a clean and safe work environment. Disciplinary action policy. The intent of this policy is to maintain clear and concise methods to establish the consistency of conducting employee disciplinary actions. Any disciplinary action in accordance with this policy must be for just cause, for one of the following: unsatisfactory job performance, including gross inefficiency or unacceptable personal conduct. For more information or questions concerning this policy, please contact Human Resources. Dress code policy. The employee's dress attire should be neat, clean, and portray a professional image in accordance with the guidelines of this policy. Pants should be neat and clean and without holes and not tight fitting. Leggings or jeggings are not permitted. Shorts are reserved for staff working in unair-conditioned settings. Shirts and blouses should be worn neatly and not sloppy. Shirts can be buttoned down or dress knit. Dresses should be no more than 3 inches above the top of the knee when standing. Shoes must be worn at all times. Open-toed shoes are not allowed in clinical settings or areas that may result in injury. ID badges must be visible above the waist and worn at all times. Piercings and tattoos must not be visible while at work. Jewelry should be kept at a minimum. Hygiene must be maintained at all times. Employees must avoid wearing distracting perfumes or colognes. Hairstyles must be in good taste and well kept. Employees must keep their hair pulled back and away from the face while rendering patient care. Any discrepancies in the interpretation of the dress code policy will be handled by the supervisor or health director. Electronic information policy. All employees must conduct themselves in a responsible and ethical manner that's lawful when handling any data processing or telephone system that is owned and issued by Scotland County. Computers that contain patient or client information or administrative information must have a timed screensaver that is set with a password. Employees must keep their passwords confidential and not share them with other employees. Long distance calls shall be made in case of an emergency or with a personal calling card. Scotland County Health Department reserves the right to review or audit an employee's access to email or voicemails. Employee call-in policy. If an employee is going to be tardy or absent from their work shift, they must then notify their immediate supervisor no later than 8:15 a.m. Employees should never leave their supervisor a voicemail unless they have spoken with someone in person and has given that person the same information. Employees are encouraged to get their supervisor's preferred method of contact upon hire. Employee legal signature policy. All written documentation by Scotland County Health Department employees require a complete signature including job title or initials. The employee's legal signature is recorded upon hire on the employee signature roster. Please see the personnel officer to record your legal signature. Grievance and mediation policy. The grievance and mediation process was established to offer a prompt, fair, and orderly resolution of grievances arising in the workplace. For more information on this policy, please contact Human Resources. Magnetic Door Pass Policy. Employees of the Health Department will be issued a magnetic door pass upon hire. Employees are responsible for maintaining their door pass and are forbidden to share it with other employees or anyone visiting the health department. Managed return to work policy. In the event of a work-related injury or illness, Scotland County is committed to returning employees to work. The affected employee is expected to engage in the process that's outlined in this policy to manage the injury or illness and return to full duty status. Notice of Privacy Practices Policy. The Notice of Privacy Practices Policy describes how the health department may use or disclose protected health information to carry out treatment, payment, healthcare operations, and for other purposes that are permitted or required by law or in accordance with the HIPAA privacy rule. Outside employment policy. The work of the county takes priority over other employment interests of employees. All outside employment for salaries, wages, or commission, and all self-employment must have prior written approval from the employee's department head before such work is to begin. The department head and the county manager will determine whether the outside work would create a conflict of interest or otherwise be incompatible with county service. The assumption of outside employment without prior approval by the county may be deemed improper conduct and subject the employee to disciplinary action up to and including dismissal. Performance appraisals policy. Each employee will receive performance appraisals on a probationary and annual basis based upon responsibilities as outlined in their job description. Performance appraisals are conducted via NeoGov. Every new employee will automatically receive a probationary performance appraisal on the 4th, 8th, and 12th month of their probationary period prior to being made a permanent employee. Social media and network usage policy. As stated in the Scotland County Health Department's Electronic Information Policy, the data processing and telephone systems, to include email, internet, computer files, and voicemail, are the property of Scotland County Health Department and are intended for business use only. If you are authorized to participate in or maintain a social media site on behalf of Scotland County Health Department, it is appropriate to post at work if your comments are directly related to accomplishing work goals. You should maintain any personal sites on your own time using non-health department computers or other electronic equipment. Some general recommendations are: be accurate, be respectful, think before you post, maintain confidentiality, and be thoughtful. Substance abuse policy. Scotland County employees are the most valuable resource, and our goal is to provide a safe, healthy, and satisfying work environment. Employees are expected to report to work fit for duty and free of any adverse effects of drugs or alcohol. Employees are prohibited from being under the influence of alcohol or substances while on county premises, working, operating county vehicles, or conducting county-related business. Employee compliance with the substance abuse policy is mandatory. Title VI Language Access Policy. Title VI of the Civil Rights Act of 1964 is a federal law that protects persons from discrimination based on their race, color, or national origin in programs and activities that receive federal financial assistance. Individuals that have a limited English proficiency, do not speak English as their primary language, and have a limited ability to read, write, speak, or understand English. Anyone who believes they have been discriminated against because of race, color, or national origin may file a complaint with the Office of Civil Rights within 180 days of the date on which the discrimination took place. See the agency's Title VI Compliance Officer for more information. Unlawful workplace harassment policy. All employees have the right to work in an environment free from discrimination and harassing conduct. No Scotland County employee shall engage in conduct that falls under the definition of unlawful workplace harassment, including sexual harassment, sexual discrimination, or retaliation. To report unlawful workplace harassment, Submit a written complaint in accordance with Scotland County's grievance procedure or directly to the county HR manager within 30 calendar days of the alleged harassing action. For more information about this policy, please contact Human Resources. Whistleblower policy. All Scotland County employees must adhere to the high standards of business and personal ethics. All employees are expected to report any incidents that they believe are not in accordance with the policies, practices, and procedures of Scotland County. A complainant may report unlawful activities verbally or in writing to their supervisor, department HR contact, department head, or straight to the county HR manager. Supervisors are responsible for reporting any received concerns to Human Resources. Although efforts will be made to maintain the complainant's identity, it is not guaranteed. Workplace violence policy. Scotland County Health Department recognizes that employees are its most important asset and will use reasonable efforts to deter the threat of workplace violence and will provide a safe workplace for employees and citizens. If you are aware or become aware of any situation that may endanger you, a client or patient, co-worker, or anyone else on county property, it is your responsibility to report it to the health director, your immediate supervisor, or safety officer immediately. This information will be kept confidential. Any employee that violates this policy will be subject to disciplinary action up to and including suspension pending investigation or termination. Leave policies. Administrative leave policy. For situations considered to be in the public interest, such as civil disturbances, inclement weather, or other circumstances deemed as good judgment or practice, the county manager may authorize leave with pay. If you are an essential employee, you are required to work during the event and will report when notified. Failure to report will be subject to disciplinary action up to and including termination. Annual leave policy. All new hires will begin to accrue annual leave in their first check. Leave accrues for each month you are in active pay status as of the 15th of each month. Annual leave requires prior approval from your supervisor. Leave must be taken in quarter-hour increments. Accumulated annual leave in excess of 240 hours will convert to sick leave based on balances of pay cycle ending June 15th of each year. Family medical leave policy. Regular employees who have been employed with Scotland County for at least 12 months and who have worked at least 1,250 hours during the previous 12-month period are entitled to a total of 12 work weeks of family medical leave. These 12 work weeks of leave can be paid or unpaid during any 12-month period. Family medical leave is only applicable after 1 year of employment. Leave without pay policy. Leave without pay is available to regular full-time employees that have exhausted all paid leave options. Short or long-term leave is subject to the department head or county manager for approval. Excessive incidents of leave without pay after the exhaustion of accrued paid leave is subject to disciplinary action. Personal leave policy. All full-time employees receive 15 hours of paid personal leave at the start of the calendar year. Employees hired within the calendar year will be prorated 1.25 hours per month of personal leave and are not authorized to take personal leave during the first 3 months of employment. Personal leave must be approved by the employee's immediate supervisor. An employee may take personal leave in increments of 15 minutes up to a maximum of 3 hours. Personal leave may be used by employees to conduct personal matters that cannot be transacted outside of working hours. Time lost reporting to work, medical and legal appointments, absences due to inclement weather, and for involvement in school activities in accordance with General Statute 95-28.3 as amended. No personal leave will be approved once an employee has tendered their resignation. Sick leave policy. The purpose of the sick leave policy is to provide paid leave time to all regular full-time employees for absences due to medical reasons. Upon hire, sick leave accrues in the first paycheck. Leave accrues for each month you are in active paid status as of the 15th of each month. Sick leave may be granted for the following qualifying events: sickness or bodily injury that prevents the employee from performing their job duties, illness of an employee's spouse, child, parent, or member of household that requires the employee's care, medical or dental appointments, period of temporary disability including recovery, exposure to a contagious disease when continued work might jeopardize the health of others, bereavement for immediate family member. Sick leave may be taken only with the approval of the immediate supervisor. Employees must notify their immediate supervisor of all requests for sick leave before the leave is taken or prior to the beginning of the work shift. Sick leave may be taken in 15-minute increments, not to exceed the length of the scheduled shift. Sick leave cannot be used for annual leave purposes. Holidays. County offices shall observe the holiday schedule adopted by the Scotland County Board of Commissioners. An employee must be in active pay status on the workday before and the workday after a holiday in order to be eligible for holiday pay. New hire required trainings. All new hire trainings must be completed within 30 days of hire. All new employees will be enrolled in the designated list of trainings that are currently in NeoGov. All new hire required trainings and individual trainings are recorded on the annual individual training plan. Certificates of completion or any other form of documentation received from completing new hire required trainings and all other individual employer trainings must be submitted to the administrative assistant. The mandatory reporting of child abuse and neglect, human trafficking, a family planning perspective, and Title X orientation training courses are currently not available through NeoGov. The ICS 300 and ICS 400 trainings are for EOC employees only. The annual individual training plan is submitted annually and will be provided to you upon hire. See your supervisor or personnel officer for more details. Annual required trainings. All health department staff are required to participate in all designated annual trainings. Annual trainings are recorded in the annual trainings column of the annual individual training plan. Certificates of completion or any other form of documentation received from completing any annual required training must be submitted to the administrative assistant. Employees may be required to complete other annual or biannual required trainings based on position or job duties. See your supervisor or personnel officer for more details. Management Information Systems Training. MIS or Management Information Systems are computer or web-based software employees use to perform day-to-day job duties. The MIS training plan is used to determine if training is required for a position and if an employee received the training. The MIS training plan is submitted annually to the administrative assistant. Please see your supervisor for your designated MIS trainings. For detailed information on all the health department's administrative policies, please visit the F Drive folder located on your desktop computer. For detailed information on the leave policies, please refer to the Scotland County Personnel Manual or visit scotlandcounty.org/414/policies. This concludes this portion of the Scotland County Health Department's new hire orientation. Now you must complete Part 2, which is a brief 3-part overview of the Scotland County policies. Thank you for being a part of our team. Have a wonderful day.